Why is mental health now integrated into COPD care? Imagine living with a condition that makes every breath a challenge and then feeling overwhelmed by feelings of sadness or worry. It might seem like separate issues, but they are deeply connected. Chronic Obstructive Pulmonary Disease, or COPD, affects more than just the lungs. It can impact your mood, thoughts, and daily life. That is why mental health is now a key part of managing COPD. Research shows that emotional well-being directly influences how well people cope with their symptoms. If someone feels anxious or depressed, they might find it harder to breathe comfortably or stick to their treatment plan. Breathlessness is a common symptom of COPD, and it can trigger fear or panic. When this happens often, it can lead to avoiding activities that cause shortness of breath. Over time, this avoidance can cause muscle weakness, less activity, and even more feelings of sadness or isolation. Depression and anxiety are not just side effects. They can make COPD worse. People who do not get help for mental health issues tend to have more flare-ups, need more hospital visits, and often feel less in control of their lives. When mental health is ignored, it becomes harder to follow medication routines or attend regular checkups. This can lead to a cycle where physical health declines because emotional health is not addressed. Including mental health in COPD care helps break that cycle. Doctors now check for signs of anxiety or depression during regular visits. They might suggest counseling, therapy, or even medications like antidepressants if needed. Cognitive behavioral therapy helps change unhelpful thoughts and behaviors, especially fears about breathlessness. It can make a big difference in reducing panic and helping people feel more confident managing their symptoms. Support groups, breathing exercises, mindfulness, and meditation are also part of the approach. These techniques help lower stress and build emotional strength. Pulmonary rehabilitation programs, which combine exercise, education, and support, have shown to improve both physical and mental health. Addressing mental health openly also helps reduce stigma. Many believe feeling anxious or sad is a sign of weakness, but it is actually a normal response to living with a chronic illness. Getting help for mental health issues is now seen as an essential part of staying healthy and living well with COPD. In the end, mental health is integrated into COPD care because it influences how people feel, how they manage their symptoms, and how often they need medical help. When both physical and emotional health are cared for together, people can enjoy a better quality of life and face each day with more confidence.